going to assess the peripheral vascular and musculoskeletal exam, and we're going to start with peripheral vascular. First, we're going to look at his upper extremities, and then we're going to look at his lower extremities. So if you want to just put your hands out, Mr. Moore. So I'm looking at his arms. They're symmetrical. I don't see the color matches his ethnicity. I don't see any lesions, open areas, ecchymosis, edema, any joint erythema. The hair distribution is equal. There's no masses that I can tell. His muscle mass is well developed and appropriate for his age. And I don't see any joint deformities either. So now we're going to take a look at his legs. Again, the legs are symmetrical. The color is matching his ethnicity. I see no open areas, no lesions, no masses. The joints themselves are symmetrical. There's no deformities. There's no erythema or edema. He has no pre-tibial edema. He has quite a bit of varicosities. The hair distribution is equal on the lower legs. Now I'm going to have you stand up, please. We're going to do the screening test for scoliosis. It's called the dive test. So Mr. Moore, you're going to stand right over there. Face me. Can you bend down like you're going to touch your toes, but not all the way. Great. So now I'm going to look first at the scapula to make sure that they are not asymmetrical. I'm going to palpate down the thoracic spine, and I feel no lateral curvature of the spine. So he has a negative dive test. So go ahead and take a seat again. We're going to check the temperature of his extremities, starting with the top. I'm going to go all the way down to his fingers. And now I'm going to check his lower legs using the dorsal aspect of your hands all the way to the toes. His extremities warm and dry, and the skin is nicely smooth. Now we're going to check the pulses. We're going to start with the brachial pulses, the radial pulses, which you can all do together, the ulnar pulses. These are all +2. Now I'm going to check the femoral pulses, popliteal behind the knee, and the dorsalis pedal pulses at the top of the foot, and posterior tibialis on the medial aspect of the foot behind the medial malleolus. Those are all +2, nicely strong. So now we're going to move into musculoskeletal. So remember, when you do the musculoskeletal exam, you've already done the neck and part of the shoulder exam by doing cranial nerve 11 assessment. So now we're going to understand that for this section, you're going to select one upper extremity joint pair and one lower extremity joint pair to palpate, do range of motion, and strength on. But for today, I'm going to show you all of them. We're going to start with these shoulders here. So Mr. Moore, if you could stand up, we'll move that chair away. Great. Are you comfortable there? That's fine. Oh, we'll do this up right here. So now we're going to palpate his shoulders. I don't feel any excessive warmth. Is there any pain when I do that?
No.
I don't feel any masses there, and I'm just going to check for crepitus. No crepitus there. And you always want to check both joints. Any crepitus?
Nope.
Great. And no pain or tenderness there?
Correct.
Wonderful. So now we're going to do the range of motion of the shoulders and arms. So the first thing he's going to do is flex and extend his arms by bringing them up over his head and back down again. Excellent. And now he is going to do abduction, abduction, and adduction. Well, you're good at this now. Great. And now he is going to externally rotate his shoulders by putting his hands behind his neck and pretend that he's washing his hair. And then he's going to internally rotate his shoulders by hiding something behind his back. Okay. And now he's going to do circumduction, which is a windmill. He's going to rotate that arm around and then in the other direction. Thank you. Perfect. And then do the other arm. Fantastic. And then rotate it the other way. Great. And now we're going to, so he has full range of motion in the shoulders, and now we're going to test the strength. So for the shoulders, to test the strength, we're going to test them in flexion and extension, abduction, and adduction. Now remember, when you test the strength on any joint, be sure that you are not pressing on any of the joint capsules at all, because that will cause the patient additional discomfort. So now I'm going to have him turn towards me. Perfect. So now, when you're testing strength, you want to give the patient really good instruction. So I'm going to push against your arms. You try to bring your arms forward, okay? Great. Now I'm going to pull on your arms, and you're going to try to push them back. Fantastic. Now I'm going to push your arms in towards your sides, and you're going to pull out. Fantastic. Now I'm going to try to pull your arms out, and you push in. Beautiful. So he has full strength against resistance, which means 5 out of 5. So he is in the numerator 5, and I am the denominator 5. I technically have full strength, and then he has full strength against my resistance. Now we're going to move to the elbows. You can turn back towards the camera. Great. So I'm going to palpate the elbows and check for crepitus. Great. Same thing here. I don't feel any warmth. There's no masses, and I feel no crepitus. So now for the elbows, we're going to do 2 different things. He's going to flex them, which means he's going to bring them in and then stretch them out. And then he's going to bring them back up again. And he's going to rotate his hands downward for pronation and then spin them back around for supination. So this is like holding a bowl of soup, and then you pour it out for pronation. Great. So now we're going to do the elbows against resistance. So I'm going to have you stand right there again. Great. So you're going to bring your elbows in for flexion, and I'm going to resist you. Great. And then you're going to come here. Great. He has full strength against resistance in the elbows. And now we're going to do his wrists. So the wrists, so come back around again. So you're going to just pull your hands down like this for extension, and then bring them up for extension, and then bring them back to a neutral position. You're going to bring your thumbs in for inversion and bring them out for eversion. And then we can do this against resistance. I'm going to press down, you pull up. I'm going to pull up, you push down. I'm going to try to bring your wrists in, you pull out. I'm going to try to bring them out, you push them in. Great, so that's the wrist, and now we're going to do the fingers. So you want to make a fist, bring it out, bring your fingers together, and then bring them out. And now we're going to do the fingers against resistance. You're going to squeeze my fingers as hard as you can. So put one finger, or you can even put 2 and cross them. And then, so he did that, he had full strength against resistance. And then we're going to do abduction and adduction against resistance. So bring your fingers back out again. Don't let me close them. Good. And then bring your fingers out. Don't let me pull them apart. Excellent. Hand strength. Very good. Now we're going to do the lower extremities. So he's going to go over here. I don't think I palpated the wrists. Yeah. And any pain when I do that?
No.
Great. And any pain in your fingers?
No.
Sorry about that. I almost forgot to do that. Okay. So now we're going to check for the lower extremities. So the first thing I'm going to do is I'm going to come over and palpate the hips. So again, you're going to just pick one of these. Any pain or tenderness here?
Nope.
Good. I'm just going to bring the leg out. Good. I feel no crepitus, no excessive warmth. There's no masses. They're also nicely symmetrical. And so now we're going to do range of motion. So Mr. Moore, could you bring one leg in front of you and down, and bring the other leg in front of you and down? Good. That's flexion and extension. And now he's going to bring one leg out to the side and bring it in, and then the other leg out to the side and bring it in. That's great. And now he's going to lift the knee up. He's going to bring it out for external rotation and bring it in for internal rotation, then drop it. Bring the other knee up, and he's going to bring it out and in and down. And now we're going to do the legs against resistance. So I'm going to push your leg in, you come out. I'm going to try to pull it back out, you bring it in. Same thing here. Again, you're not touching the joints. Great. Now he's going to try to bring it out to the side. I'm going to push it in. I'm going to try to push it out. He's going to bring it in. And then same thing here and here. Good job. All right. Now you're going to sit back in the chair. Great. Perfect. Now for the knees, he's just going to extend them out and then bring them in for flexion. I would palpate them. Any pain when I do that?
No.
There doesn't seem to be any crepitus. Great. And no excessive warmth. And then we're going to do the knees against resistance. So you're going to straighten your leg and then bring it in, straighten your leg, and bend it again. Great. And that's a 5 out of 5 there. And now we're going to move down to the ankles and feet. I'm going to palpate the ankles. Any pain here?
Nothing. No.
Good. Excellent. Great. So for the ankles and feet, you're going to bring your toes up to your nose for dorsiflexion. You're going to point them for plantar flexion. You're going to bring the toes in towards the middle for inversion, and then rotate the ankles out for eversion. And now we're going to do all that against resistance. So you're going to bring the foot up to me, put on the gas. Whoops, put on the gas. Good. Bring the foot up to me, and put on the gas, and bring it in towards me. Bring the toes towards, yeah, that's great. And then bring them out. Great. And then bring them in and out. Great. Excellent. He has 5 out of 5. Strength against resistance, also in the feet. And that concludes the musculoskeletal exam.